What not to eat if you have kidney stones, and the foods to avoid and why. This is a very intricate subject. You know that to make kidney stone, we need to provide essential concentration of certain minerals and salt in the urine. Kidney stones primarily are of four kinds: calcium phosphate stones, calcium oxalate stones, struvite stones, and cystine stones. Out of all four of them, majority of us will have calcium oxalate stones. If you know what kind of stones you are developing recurrently, dietary changes are imperative, because if you take away the ingredients which are required to make those stones, you will be able to prevent a lot of pain and suffering. If you do not know the chemistry of your kidney stone, chances are you have calcium oxalate stones. The recommendations in this video are first general, then stone specific. The mechanism of stone formation, as I alluded, is to provide minerals and salt in a proper concentration in the urine so that they could mix together and make a stone. If you stay dehydrated or you do not drink enough water, you are at increased risk of making kidney stones. Second, if your diet is high in salt, that dehydrates you and make conditions possible to you develop kidney stones. Number three, if you eat lot of processed meats which provide a raw material for uric acid stones, then you are at high risk to develop stones. If you drink lot of liquid sugary drinks which are sweetened by high corn fructose syrup, you will be at high risk to develop kidney stones. These recommendations are for everybody who is suffering from kidney stones. If you know your kidney stone chemistry, let's take them one by one. For oxalate, you need calcium and you need oxalate to mix. Oxalates are absorbed in your gut. Most of the time, it binds with calcium and you pass it on. Whatever is left, that got absorbed into your blood and goes to your kidney to make kidney stones. So if you have calcium oxalate stones, you must balance calcium intake and oxalate intake so that whatever nutritional requirements you have, they get met and extra is passed out of the gut. Most of the time, we do not eat enough dairy or calcium sources with oxalate-rich food. The foods to avoid which are high in oxalate are spinach, beet, rhubarb, Swiss chard, almonds, peanuts, chocolate, and also soda. If your diet is deficient in calcium sources, diet which will include dairy, meat, and yogurt, you will have very high incidence and prevalence of kidney stones which are calcium oxalate. Pair oxalate-rich foods with calcium sources. Cheese with spinach to reduce the absorption of oxalate. Next is uric acid stones. If your diet is rich in meat, you are consuming a lot of load of purines which your body may not be able to handle, and you will provide necessary environment for uric acid stones. Third, struvite stones. If you are having repeated infections, you must follow general precautions. And if you have some genetic disorder where you having cystine stones, then you must consult your doctor. Further, do not consume high doses of vitamin C. If you drink plenty of water, moderate amount of calcium, include citrus-rich foods like lemon, orange, and banana, and limit animal protein, you could limit your chances to decrease incidence and prevalence of kidney stones, and we could avoid unnecessary pain. I hope this video was informational. Like, share, and subscribe to our channel, Kundlas MD, and I will see you in next video. Thank you.